Hello? Hello?
Yes, sir.
Am I audible?
Yes, sir, you're audible. Tech team, are you there?
Hello? Should I share the video or no?
Yes, sir. So you can share your screen now.
I can.
Tech team, can I have the CV slide, please?
I have the CV slide with me. I can play it.
Okay, sir. So you can play it.
As per the protocol, yeah.
Okay.
So,
Good afternoon, everybody. We will be doing a very interesting session on dermatosurgical procedures, and I'm extremely honored to announce that it will be presented by Dr. Sachin Verma, sir. And he needs no introduction, of course. He's the chief dermatologist at Skin Beta Clinic, Kolkata, and he has numerous publications and presentations to his name. And sir, I would like to invite you for this session and begin with the presentation, please.
yes. So I would like to thank IDVL West Bengal and all the members of the IDVL Scientific Committee for inviting me for this talk. Dr. Sumit Sen, Dr. Adrija, Dr. Shreya Poddar, and all the people who have been working constantly for these sessions. And it's an honor to present today the videos or the demonstrations of various procedures. I was asked to have video presentation for 4 different procedures, and this is what I would present. I was told to demonstrate Derma pen, Derma roller, blister grafting, and melanocyte transplant. So in short, half an hour, I had to demonstrate 4. So it was a challenging task, but I've made videos which would help you with the process. The first demonstration is Derma pen and Derma roller. So let's start with the video and then we'll take it from there. If anybody has any questions about the procedures, they can put it on the chat box.
Hi friends, I'll be demonstrating Derma pen procedure to you today. So this is a typical Derma pen 4. You get Derma pen 3 and Derma pen 4. This is a typical Derma pen 4. The advantage of a Derma pen 4 is that it has a battery which is charged and you can just charge it. This is a chargeable battery which...
Sorry, what happened? Yeah, sorry, I think it got, yeah.
Hi friends, I'll be demonstrating Derma pen procedure to you today. So this is a typical Derma pen 4. You get Derma pen 3 and Derma pen 4. This is a typical Derma pen 4. The advantage of a Derma pen 4 is that it has a battery which is charged and you can just charge it. This is a chargeable battery which fits in here. And the advantage is that once you have this battery charged, you can use this device without a wire. You can move the device freely on a patient without having a cord attached to it. The second thing about this Derma pen is it comes with a separate needle, which is separate than the normal needle, and it has multiple pins inside. So if you see a Derma pen, this is a typical needle, and if you see on the surface, it has 25 needles in it. So this is a needle which has 25 needles. This is a Derma pen, and it fits into the device like this. This is a typically. The first thing to understand in Derma pen is the needle should be a new needle and it should be given back to the patient, because you can do about 3 or 4 procedures with this needle. And this needle, because it's an invasive procedure, can't be shared between patients. So this actually belongs to the patient. You can do 3 or 4 procedures once every 15 days with the patient, but the needle cannot be shared. So this needle is like this, open, and you write the name of the patient. You can give it to the patient so that he can bring it next time when he comes. So right now, this is what we see, and there is a tip attached to it, which is a tip that we remove. This is a seal tip of the needles. The first step is to fit the Derma pen needle and lock it. You have to see that it has to be locked. It can't be pulled out. It has to be locked, because this moves at a very rapid speed, and if it is not locked, the needle can fly and produce injury to the patient. The second step is to see the screen of the Derma pen. This is the Derma pen screen. And this portion on the upper lines indicates the speed. So right from 1 speed to 4 speed, you can see we have various speeds. And this 1.5 is basically the depth of the needle. Now, a Derma pen has depth right from 0.2 right up to as you can see here, stamping mode, which is about 3 millimeter in depth. So you have 0.2 to 3 millimeter depth of needle. If you select 3 millimeter of depth, then the needle will go and penetrate 3 millimeter deep. If you have to 5 millimeter. It has a very high speed. So it moves at a high speed between 300 to 400 resolutions per minute when you move that on the area. And the other advantage of the Derma pen is that it is unlike Derma roller, where you have to move up and down, so all the needles penetrate at different depth. Because this is a straight device and a stamping device, all the holes are of a similar depth all over the face. Coming to how do you do that on the procedure on the patient? The first thing is the indication. So what are the indications of Derma pen? I think this is a very versatile device. It's a colorblind device. Colorblind meaning you can do it on any patient. You don't have to actually wait on between patients. Coming to the second step, I think the second step is the case. The second step is actually the patient selection. And in a patient selection, it is to be understood, it's a colorblind device. It does not depend on the color of the patient, unlike lasers, where we have to look at the color and see if it's a dark skin, whether do CO2 laser or not, which laser to choose is a color hand device, because colorblind, it can be used on any patient. Now, normally, what are the indications? Mostly from rejuvenation to scarring. So there is a wide variety of indications where we can do a Derma pen. In rejuvenation, we can use 0.3, 0.4 mm depth of the needle depth and use certain ingredients like cosmeceuticals, which can be given into the skin. 0.3, 0.4 mm of Derma pen depth actually helps in rejuvenating by exfoliating the topmost layer, clearing by making tiny holes, and then through these tiny holes you can make the cosmeceuticals go in. So it can be used for rejuvenation. But 0.5 and above can also be used for scarring, like for example acne scars, for example chickenpox scars, for example multiple other scars, post-traumatic scars, post-injury scars. So there are various scars that you can use it for those conditions. In a stamping mode at 3 mm depth, you can also use it for localized scars. You can just do a stamping mode with that. So this is the various indications where it can be used. In this patient, she has acne scars and will demonstrate how a Derma pen is used. The first step is patient should wash the face. Before doing a Derma pen, is there a contraindication? Yes. If there is an active herpes lesion, then you cannot do Derma pen. You must always ask a history of herpes simplex to the patient before doing a Derma pen, because if there is active herpes, you should be careful, or even a history of herpes, you should be careful of doing a Derma pen. The second is there any active infection on the face? If there is an active infection, it's a contraindication. You should not do a Derma pen when there is a multiple active staph or streptococcal infection, because by using a needle, you're going to spread that infection at the other side. So the other absolute indication, absolute contraindication of not doing a Derma pen is an active infection at the face. Then on any other procedure, I would insist, it is very essential that you use the right cosmeceuticals, because the cosmeceuticals is, along with the procedure, gives the best results. So if you just use a Derma pen without using the right ingredients, because there are two aspects of the treatment. One is the micro needling, which is producing the action. The second is the cosmeceuticals, which are going in and triggering the response or the repair mechanisms. So ideally, I always suggest to the patient to get the best results. Do not be penny wise, pound foolish by saving on the cost of the cosmeceuticals. These comes expensive, but you must use the cosmeceuticals and do the procedure as it is recommended, rather than cutting down the shots and giving half results. So there are various cosmeceuticals available from hyaluronic acid called Hyalactive. There is Bright Light, which contains various lightening agents, like caprylic acid, kojic acid, canna food oil, and jojoba protein, and a lot of other glycerin, kojic acid, dipalmitate. So it has lightening agents. And there is Retinal Active, which is a retinaldehyde, which is used for the repair of the skin. So there are different ingredients. You can choose the ingredient based on the treatment that you want. Suppose you want for lightening, then you can combine hyaluronic acid with bright light. Suppose you want for acne scar repair or for rejuvenation, you can use hyaluronic acid with retinol active. So there are different ingredients available and you can choose the ingredient depending on what you want so that you can get a good result. The first step is to take this in the bowl. The right amount of ingredient is also important. Taking it less may not be always right. In fact, taking it more is better. So this is what you take inside and then you dissolve it nicely. Whatever ingredient you have taken, you should mix it properly so that all the ingredients are properly mixed. You should use a hand care or something and not touch the ingredients directly because these are sterile. So I have taken a sterile hand care and then apply it on the face of the patient. Apply it on the area that you want to treat first. Don't apply all over the face together because it tends to dry up very fast because it has hyaluronic acid. Then you set the depth to the right depth that you want to do. Say in this patient, for the demonstration, say we want to do 0.3 mm depth, increase the speed to full and then start the procedure and then move it. It has to be moved in 4 directions, vertical, horizontal, diagonal in one direction and diagonal in other direction. It has to be moved in 4 directions. Again, I do it. And you have to repeat 5 to 6 such cycles in each region. So as we saw one, when we are doing the second cycle, once you have done a derma pen in that region, then see that you massage this cosmeceutical inside so that it goes in through these tiny pores and start producing the action. You should wipe it off. You should massage it in so that it goes in. The next step is being more accurate in what you are doing is that as you see in this patient, there are multiple tiny holes which you also need to be connected. So what you can do is you can be smart in modifying your treatment. You can use a greater depth and just do with 0.6 depth only in that area. Again, if you want the scars are deeper, you can select even 0.9 or 0.1 or 1 mm thickness depth. And again, do it in that area for the scars to increase. So this has to be done only in the areas where there are deeper scars. And if there is one single deep scar, say for example, there is a deep scar there, you can go for stamping mode and just stamp at the area where you have a deeper scar. So in this way, you can use various depths of the treatment. As you see, the moment you use stamping mode, there is a small blood oozing there. That means you have reached the right depth. So therefore, you can do various depths of treatment and all types of skin. I'll be demonstrating derma needle or derma roller to you. This is a typical derma roller. The first thing in derma roller is see that you take the right derma roller. Now you would see that on sites like Amazon and a lot of other sites, you have very cheap quality derma rollers available for 50 rupees, 80 rupees, 110 rupees each derma roller. And if you buy 10, you get 5 free and comes very cheap. Now there is a problem there. The problem is a derma roller always depends on the type of the needle. You must make sure that the needle is either gold plated or titanium plated to get the best result. This is number one. Second, because if the needle is not good or the needle quality is not good, the moment it's going to go inside the skin, it's going to clear the skin away or the shape of the needle will change. And if the shape of the needle changes, when you move on the skin, then it will not cause uniform depth of holes and it will cause laceration wounds because you have to move that over the skin. So selecting a right derma roller is the most important step in a derma roller procedure. Derma roller is a great procedure for people who do not have a derma pen device, and therefore it can be used in alternative of derma pen. If you have a derma pen, then of course derma pen has better results or can do a much better because it moves at a faster rate with uniform depth. But if you do not have a derma pen, you can use a derma roller to produce a similar action. The difference between derma roller and derma pen is that in the same needle, in a derma pen, you can change the depth. Whereas in derma roller, you have to take that call before the procedure as to what is your maximum indication. It can be 0.5 mm of derma roller, you can have 1 mm of derma roller, you can have 1.5 mm of derma roller, 2 mm of derma roller. But that decision has to be made prior, and you cannot change the depth unless you try to use multiple derma rollers on the same patient. So the decision of a derma roller has to be made prior. You have to see the patient, see what kind of scars are out. And this is a typical derma roller. You remove the derma roller needle cover. So it comes with a cover which has been removed. Now this is a typical derma roller. You can see the multiple needles here inside. And the derma roller is actually also depends the price depending on the number of needles that are present inside there. So this is typically 0.5 mm derma roller, and it has, I think, 256 needles in it. So depending on the number of needles also, the results vary. And then you have to apply a hyaluronic acid or a cosmeceuticals or ingredients that you want to put in. The problem with derma roller is it does not come with a standard cosmeceuticals with it. It does not come with it. And therefore you have to use your own cosmeceuticals. Though if you have both derma pen and derma roller in your clinic, you can use a derma pen cosmeceuticals with the derma roller also. But you get hyaluronic acid, you get various growth factors, you get various other solutions which can be applied on the face of the patient, clean the face. All practically the treatment precautions and everything remains same as in derma pen, like contraindication of herpes, active infection, all that. And even the movements remains the same, 4 to 5 movements in 4 directions, vertical, horizontal,
Now I'll be demonstrating my second procedure, that is blister grafting. And this is, we start with blister grafting, please.
First step in the blister grafting is the right choice of the case. It is very important for us to understand when we choose a patient of blister grafting, the patient should have limited vitiligo. It should have a first step in the blister grafting is the right blister grafting. This is a patient where we have a small patch here and 2 patches on the forehead. So this is step number 1 in blister grafting, choosing the right case. Step number 2 is choosing the donor area. The donor area is generally the left side. If the patient is having the vitiligo on the right side, we generally choose the left leg, and the upper medial thigh is the donor area. We shave off the area. This is step number is choosing the right equipments. We should take a 20 ml syringe, remove the gel from it away. Then you must take a 3-way cannula and put it on the top of it. This is a 3-way cannula that you have put on the top of the 20 ml syringe. Next step should be taking a 50 ml syringe or a 60 ml syringe here, putting it here, and then creating a negative pressure, as we can see here. This is step number 4. Create a negative pressure of 50 mm and then block it. This then gets locked. This is the negative pressure created. You have to create 4 or 5 punches like that, or 4 or 5 blisters like that.
So here you can see we have created 4 and 5 blisters on the surface in the similar manner. To save cost, I'm slightly forwarding the video. But once we have created the
Here, right, like this.
This was demonstrating how
then
to take the
this
3-way cannula.
open end should be on the opposite side, which is now open, so that you are pulling the air. And then it should go down. It should look down. Go down. Yes, it is now C. You have created 4 or 5 blisters depending on the amount of blisters that you need. Then you have to wait for 4 hours for the blister to be generated. During this time, patient will lie down in the OT and you can do your other job. So now after about 4 hours, we have removed those syringes which have the negative pressure of 50 ml, and you can just focus it here. You can see this wonderful blisters that has been produced in that area. Clear transparent fluid indicates that the blisters has been perfectly made. You can see it here. Give local anesthesia at the site of the recipient. So we will just give local anesthesia at the site of the recipient. The next step is to load the dermabrator. Here we have loaded the dermabrator. You must pull it and see that it is not coming out. It should not fly. Locked it properly. And then we should move it and see whether it is working fine. You can see that it is working fine. Next is to dermabrate the recipient site. What we are doing here is we are dermabrating the recipient site. You should dermabrate till you see a fine red surface. You should dermabrate till the time you reach this fine, tiny bleeding points. You should not dermabrate greater than this. When you see this tiny pinpoint bleeding site, this is the end of the dermabrasion. Prepared all the 3 beds with tiny pinpoint bleeding at all the 3 sites, which clearly indicates.
Sorry.
You should dermabrate from the base and then take it on the slide on the reverse. Now the blister is on the slide. Then you separate this is the blister you have taken on the slide. Separate the dermal component. This is the next step. You've separated the dermal component. See how easily it comes out. And our donor graft is ready. This graft has to be next put on the recipient side. That is the end of the search. Next step is to put the graft on the recipient side just like this, separating the entire graft. You can here see that the graft is completely taken up and this ready. Once you have placed the graft completely, as you can see here, then you will just put a bactigras and then do a dressing. Open the dressing up.
So this is after the surgery, after 3 days, once we opened the dressing, this is how it looked. The patient after 3 days, you see that the graft is taken up. And now this is a patient which we did last month. You can see how wonderful you can get the results after 1 month. You can't even make out after blister grafting that this patient had a localized vitiligo on the face because it matches completely without any cobblestoning or anything. My last presentation is on melanocyte transplant. I would start it here. Yes, please.
Hi friends, I will be describing to you today in my 3rd procedure, that is the melanocyte transplant. Now, melanocyte transplant is a specialized procedure done for stable vitiligo. So the first precondition is you require a stable vitiligo, and melanocyte transplant has an advantage over sponge grafting and blister grafting is because you have a solution which is the pellet containing melanocyte, which can be used at about 4 to 5 times. Some people say even up to 10 times of the donor area. So if you have a donor area of 10 centimeter, you can actually donate to about 50 to 100 centimeter of the recipient area. To the patient of melanocyte transplant, what you require is to have the patient ready with you with a stable vitiligo. The first thing that you do is you shape out the area from the thigh, from the donor area. Prepare the area by giving local anesthesia. Generally, a rectangular block anesthesia is good enough. After you have done the local anesthesia, then you must have a Humpy's knife with you. This is a Humpy's knife, and there is a blade with it. This is a sterile blade. You have to fit the blade into the Humpy's knife. This is how you have to open it. You can see the opening here, and you have to put the blade in between this opening. Once you put the blade, then you have to seal it and make a distance of 0.3 to 0.4 mm. Once you have done that, you can see you have sealed it now. Once you have done that, then the blade is ready here, and then you have to use the Humpy's knife to cut the skin. Once the skin is ready, then you must take the skin in a test tube. You have to take the skin in a test tube. You have to add the skin with a forceps in a test tube. This is step number 3. So step number 3 is you must take normal saline and wash the skin that you have taken and remove the blood particles that are stuck to the skin, the extra tissue that is stuck to the skin. Wash it up with normal saline. Your skin is ready, then you must have a trypsin mixture. This is a trypsin powder with a trypsin solution that you must have. You must put this into the test tube where you have the skin. Skin ready. This is the skin with this trypsin mixture. You have dissolved the trypsin powder in a trypsin dissolving solution. You have put that solution inside the skin, and you have to incubate in the incubator for about 75 minutes. That's 1 hour, 15 minutes. Every 10 minutes or so, you have to come and shake the solution so that the skin is nicely dissolved in the trypsin. After incubating for about 75 minutes, you will have a skin which is ready for your use for your melanocyte transport. So once we have the solution ready with us, which is incubated with trypsin, the epidermal cells get separated from the dermal component. That you have to put in this petri dish. After putting it in the petri dish, you have to add this washing solution that comes with us. This washing solution actually removes the trypsin that is in that solution. You have to use this. Wash the solution 1 time, maybe wash it 2nd time. Once you have washed the solution, you have to take a filter and a fresh tube. Another test tube here you have to take and put the test tube into the, like this, and put that filter, that skin here. What happens is that the dermal component gets occluded at the top, and all the melanocyte solution that is being separated goes down. Before you do that, you must remember in this petri dish, the skin that has come out, you must separate the epidermal cells from the dermal by manual forceps. Once you have done that, then you must put it here. The melanocyte solution is here. You must then take this solution and put it for centrifuge for about 15 minutes at about 2,400 revolutions per minute. Once you have taken this in this solution and you have centrifuged it, what you get is a down thick solution and a supernatant fluid. With the help of a pipette, we have a pipette here. Where are the pipette box? So once you have taken this, once you have centrifuged, you will see that the pellet will be down and there will be supernatant fluid. Then what you should do is you should remove the supernatant fluid with the help of a pipette and throw it away. The remaining pipette, then you should take 10 ml of blood, centrifuge the blood, separate the serum and put in this solution. The blood contains antitrypsin and will actually neutralize the remaining trypsin that is present in that solution. After this, then you should do a second centrifuge for about 10 minutes at about 1200 rpm. What this does is it separates the melanocyte pellet below, and the supernatant fluid is taken. You just throw away the supernatant fluid, take the pellet. The recipient area you must prepare by doing a dermabrasion at that site. Take the pellet which is being collected and spread with the help of a pipette on the surface of that, and you can dress it with a tegaderm or some kind of an occlusive dressing. Keep it occluded for about 5 days, remove the dressing, and you are ready to go.
So thank you, everyone. This is my presentation for today. I want to thank IDVL for giving me this opportunity. And if you have any questions, any PGs, anybody, please feel free to get in touch with me. I'll be happy to help. Any questions, please? So if there are no questions, then I can probably, stop share and then see if there is any questions or any chat, anything, anybody has put anything. We'll be checking out. I'll be taking on the next session in half an hour. So if anybody has any questions, they can get in touch with me at my mobile number, which you can take from the organizers. Thank you for giving me this.
Thank you so much, sir. Thank you so much, sir, for such a wonderful and crisp session. And it was extremely positive, nice, and we're honored to have you. Thank you so much, sir.
So can we exit now? Is it done?
Yes, sir. So we can leave this session.
Thank you.
Thank you, sir.
Yeah. Anybody?
Sir, leave this room and join hall A.
All right. Okay. Thank you. Thank you so much.
Sir,
Yeah. Tell me.
Sir, Dr. Sumit Sen, sir, is sending his regards and thanking you for
No,
being
no,
a part
thank
of the
you.
session and doing it so wonderfully.
No. Thank you, Dr. Sumit, for giving me this opportunity. We are always grateful to him and all his
Sir,
team,
it's always
Adrija, you and everybody. I would also request if any of the PG residents want to learn melanocyte transplant, or if any PG resident wants to learn.
Hello, Sachin.
Yes, sir. Please tell me.
Hello.
Khub bhalo, sir. Thank you so much for inviting me over. I'm actually honored, and it was a real pleasure to.
We are honored. Our students and junior faculties and also senior faculties have enjoyed your session very much, as is expected, and we want more of such demonstrations. And don't forget my students. I'll be sending them to you off and on.
Yes, sir. This is an open invitation. All PG residents, anybody wants to
Okay.
come and learn any melanocyte transplant, anything, blister
Fine.
grafting, please feel free,
Thank
sir. Thank you.
Thanks a lot.
Thank you, sir. Thank you.
Okay, thanks a lot. Carry on.
Thank you.
Thank you, sir. And
Thank you.
with this, we come to the end of this session.